Why Japan? National health insurance. Studying abroad in Japan is an exciting adventure, but sometimes unforeseen things happen. You could catch a cold or get hurt. And that might worry you. We hope Japan's national health insurance program can put you at ease. Did you know that anyone living in Japan is subscribed to some form of health insurance? If you study in Japan for more than 3 months, you will be joining NHI. NHI is a system where the national government, local governments and individuals share medical expenses. You can join NHI at your local city or ward office and decide how you will pay the regular fee. A few days later, you will receive your NHI card. Don't forget to bring this card with you when visiting the doctor. Then you only have to pay 30% of the medical costs. The other 70% is covered by NHI. Whether you are visiting the doctor for a cold or the dentist for a toothache or going in for surgery, 70% of your medical costs are covered. Prescription drugs too only require a 30% co-payment by you. And it doesn't matter how small or large the hospital is or where you are in Japan. Let's hear from some international students.
I pay 2,300 a month. I don't think it's expensive. It's the same price as a simple haircut.
That's reassuring. Now, when and how was this system developed in Japan? A similar system traces back to the 19th century. In poor rural areas, peasants would each contribute rice regularly to secure access to a doctor for everyone in the village. This system is called jōrei and is considered the prototype of Japanese health insurance. The earliest model of Japan's current health insurance was established in the early 20th century. In 1918, an influenza pandemic spread over the world. As a countermeasure, people in Japan started wearing masks, a custom still practiced today. In the 1920s, countries around the globe established public health insurance systems. Japanese health insurance developed from 1922 onwards, and eventually all Japanese citizens and residents had access to national health care. Healthcare is not just affordable in Japan, the quality is high too. Japan has one of the highest standards of medical care, ranking number 10 on the list of WHO member states. Boasting more than 65 hospitals per 1 million people, Japan has the third highest hospital density among the OECD states. And with 13 beds per 1,000 citizens, Japan also has the highest density of hospital beds out of all WHO member states. And to top it all off, the number of doctor consultations per person per year is the second highest out of all OECD member states. These numbers show how accessible Japanese medical care is. It's reassuring to hear about Japan's NHI and the high standard of medical care. But what is it like to actually go to the doctor in Japan?
It was a very good experience every time. The nurses and the doctors are always very nice. They try to make sure that I feel at ease, that I understand whatever is going on around me or with myself, what health problems I have. They sometimes even check the medical terms on the internet and explain in English.
Why Japan?
That's why.